Call the February 9th Human Services Committee meeting to order. Looking for approval of the agenda?
So moved. Support.
Any additions, corrections? All in favor say aye.
Aye.
Opposed, the same? Agenda will be as printed. Public comment. Is there anyone that would like to address the board under public comment? Seeing none, we'll move on to committee items. We have the minutes of the January 12th meeting. Looking for a motion to approve those minutes as printed.
So moved. Support.
We have a motion in support of those minutes. Any comments, corrections? Seeing none, all in favor of accepting those minutes as printed, say aye.
Aye.
Opposed, the same? Minutes will be accepted as printed. Under appointments. 1 second, we'll pull this up here. We have a variety of appointments that are needed. First of all, under commissioner appointments, Food Protection Hearing Board, we have this individual must be a member of Human Services. Our current member for Food Protection Hearing, the position has been served by Carl Rice. A second one also, we have been served by John Polacek. At this time, are you gentlemen willing to serve again, and or are there any other applicants?
Madam Chairperson, I would respectfully like to remove myself from this. I did not fill out an application precisely for that reason, and I would like to nominate Commissioner Mahoney.
Second.
All right. So we have an applicant of Commissioner Mahoney. Commissioner Polacek, are you interested in serving as well?
Yes, I'll continue to serve.
So we have two applicants that are willing to serve. Are there any other Human Services Committee members that are interested in these positions? Seeing none, we will vote on the slate of those two candidates for those two positions. All in favor say aye.
Aye.
Opposed, the same. These names then will be placed under committee appointments. I am not sure. Does this need to go to full board, or I think this is settled here? I believe it's settled here. Okay. We believe so. Human Services Coordinating Alliance is served by the Chair of Human Services. I continue to attend their monthly meetings, and I will continue to do so. So all in favor of following on with the tradition of the Chair, please give your approval by saying aye, please.
Aye.
Oppose the same? All right, I will continue in that position. MELF. The MELF position is needed by a Human Services Committee member. The former member that served was Commissioner Gail Mahoney. Are there any individuals that are interested in holding this position?
I would be interested.
Are there any other individuals that are interested? Seeing none, we will move Commissioner Daniel, thank you, Mahoney's name forward. And all in favor say aye.
Aye.
Opposed, the same. So Commissioner Daniel Mahoney will be serving in that committed appointment. Moving on to Sanitary Code Board of Appeals. The main position has been held by Commissioner Rice. Commissioner Rice, are you willing to continue to serve in that capacity?
Yes, I am.
Are there any other Human Services members interested in that position? Seeing none, our one applicant is Commissioner Rice. All in favor say aye.
Aye.
Opposed, the same. Commissioner Rice, you now have that position. We have an alternate position of Sanitary Code Board of Appeals. Current member is Julie Alexander. Are there any interested members that would like to replace me?
You're doing a fine job as
Okay. I would be willing to serve if needed, but I'd be happy to share that position. All right, I will put my name as an applicant then as the alternate. Seeing no other applicants, all in favor say aye.
Aye.
Opposed, the same. So Commissioner Alexander will be the committee appointment for the alternate position of Sanitary Code of Appeals. Moving on to the two positions under Sanitary Code Board of Appeals that are public members. We have the first one being a licensed sewage system installer. Our current member is serving on this board is Jack Ripstra. Although his name is not listed under an applicant, I did have a personal conversation with Mr. Ripstra, and he is willing to continue serving. Are there any other names of individuals that are interested in a public position here? Seeing none, our one applicant then would be Mr. Ripstra. All in favor say aye.
Aye.
Opposed, the same. Mr. Ripstra will continue then with that committee appointment. The second position is an alternate position and is currently held by Christopher Crisenberry. Mr. Crisenberry, according to our document in front of us, is willing to serve as in this alternate position. Are there any other public nominations that would like to be made? Seeing none, our one applicant is Mr. Crisenberry. All in favor say aye.
Aye.
Opposed, the same. Mr. Crisenberry, it appears, has that position. Next on our agenda, we have a Lifeways monthly report. Welcome back, sir. Good to see you.
Hello, my name is Gerard Saraki. I am the CFO at Lifeways, for those of you who may not know me. I know some of you do. Mary Beth extends her apologies for not being here today. She's at conference this week along with a number of other staff, so I was asked to step in for her this morning or this afternoon. So I know you received a packet of information. There's quite a bit of information in there, and I'd just like to go over a few things. The first being the Lifeways annual audit. We're on the downside. Well, first let me kind of preface it by saying it's a two-part audit, if you want to call it that. It's a financial as well as compliance. So we're on the downside of the financial part of the audit, and we need to really complete that before we can start the compliance part. And by completing the financial audit, I'm referring to the FSR, the report that goes to the state, and then once that's completed, then the auditors will start the compliance section. So that's in process. When we have preliminary figures, we will be reporting those back to you, possibly in the next 30 to 60 days, so if not next month, then the month after. So that is going on. And the second item I'd like to point out for you folks is the report that's included that was presented at the legislative luncheon. For those of you that attended, thank you for attending. We know your schedules are very busy, and so again, thank you. For those of you who were not at that luncheon, the report is included for your reference. The next item is we wanted to kind of talk about is the intensive crisis stabilization. This is a new program that we started in December, and after approximately 90 days, Mary Beth or someone, probably Mary Beth, will report out and give some outcomes related to those to that service. Real quick, what that service is we have staff that are on call 24/7 that will respond to a consumer's needs, and one of the advantages or hopes that we are looking for is that we would prevent that consumer from going into the hospital stay, which can be very costly. So tending to their needs on an immediate basis might prevent them from entering the hospital. So that's certainly one huge advantage from a financial perspective, plus the hosts of clinical advantages, which I'm not really qualified to speak about or speak to. So that was one of the items we wanted to highlight within the packet. The other thing is Mary Beth continues to be on a number of statewide regional work groups, and I know, believe from previous appearances here, she's very involved in a number of those, and hopefully those are being, that information is being communicated back to you. I'm sure it is. That will continue as per usual. And finally, the last item that actually is one of the topics at the conference this week is the merger between the MDCH and the DHS. So I don't have a lot of details on that. I just, of course, rumblings that is going on. And again, Mary Beth this morning indicated that that's going to be on one of the agenda items at the conference. So the next month's report, she'll be providing you folks with a report on what was discussed at conference. So that pretty much wraps up the items I wanted to talk about, and if you have any questions about anything, I will attempt to answer those, or you certainly could email Mary Beth.
What comments or questions might you have for Gerard? Or for him to forward on to Mary Beth?
Or myself. You certainly can forward them on to me. I know a number of you have my email, so don't feel like it has to go to Mary Beth, or both of us, so.
Thank you, Commissioner Rice. We didn't want him to get away so easily. Thank
No.
you.
Actually,
we
it's
gotta
not
Make
even-
him work a little bit.
Yeah, actually, Gerard, it's not even a question. Just really appreciate the luncheon that Lifeways had. I felt that it was represented well. We had quite a few elected officials, including Senator Shirkey and Representative Pileski, and obviously, there's a lot going on, and there's a lot of tough issues going forward. The potential threat, I don't know if you want to call it a threat, but the potential of privatization and things of that nature were explained, and I'd just like to say that, Lifeways is getting ahead of the game, and if it happens, it happens. They're ready for it. If not, they're ready to move forward without it too. So, again, I just wanted to say thanks, and thanks to the work that you do. So.
Thank you, and just to add a little bit to that, Mary Beth has been very, very clear and adamant about the potential future of the mental health industry in Michigan, and as an organization, we want to be part of that, of serving certainly our consumers, whether it's in a public format or a private format. So appreciate your comment on that, Mr. Rice. Thank you.
All right. Seeing no other comments or questions, thank you for that presentation.
All right, thank you.
Next on the agenda, Community Action Agency. I do not see anyone here, nor have I heard from anyone as to if they are coming in later. The motion, I understand Adam is covering for me. Deputy Administrator Brown.
The item before you is to change the area for the CDBG grant. If you'll remember, I think it was around last year this time, or maybe even longer than that, the MISTA's new strategy was to target areas to spend the money, or annual allocation, or at least a large percentage of it. That hasn't worked very well, in that we haven't been able to find applicants to be able to use that money. So the only way to be able to use that money is to expand the area. So Toby's requesting to add Blackman and Subbit Township to be able to expand the areas of opportunities for to use the HUD funds.
Mr. Brown, did she indicate that by adding that, modifying that area, that she feels that we would be successful? Or is she just hopeful?
Hopeful, but I believe she thinks we'll be successful in those two areas. It's a large population chunk.
Commissioner Rice?
County.
If I'm not mistaken, I believe she already has some areas in Blackman and Summit that she feels that would take advantage of this. So I, for one, will go ahead and move this forward.
So we have a motion on the floor right now to move this item onto full board to authorize the county administrator to make a request to MSHDA for the addition of Summit Township and Blackman Township to the CDBG target areas for the 2013-15 grant cycle. Looking for support?
Support.
We have support as well. All in favor of this motion, say aye.
Aye.
Opposed, the same? This motion will now move to the full board. Thank you, Adam. Next on the agenda, we have the medical care facilities financial report. It is included in your board docs. Is there anyone that would like to address anything on that? Moving on, Department on Aging monthly report. Ms. Marcy?
Good afternoon. Wanted to explain a little bit about a program called PACE, which stands for Program of All-Inclusive Care for the Elderly. And PACE is something that the Region 2 Area Agency on Aging has been working on for a few years, at least 2. And there are PACE programs already available in Lower Michigan. There's one in Battle Creek and one in Ypsilanti. And the concept is that people age 55 and older who are eligible for Medicare and Medicaid would go, their primary physician would change to the PACE program should they so choose, and they would receive all their medical care and any therapies at the PACE location. And the property that has been purchased is on Springport Road in Blackman Township. And I don't recall when they plan to open, but it would be in 2016. And Commissioner Rice does serve on the Area Agency on Aging Board. So I just update about PACE, that it is coming to Jackson County, and it will be a regional program for Jackson, Lenawee, and Hillsdale. And transportation is included as part of the program so that people can get from their home to the PACE location and back again. So that's a real asset. So, any questions? Okay. And as Gerard from Lifeways just mentioned, the announcement of the combination of 2 state departments, Department of Human Services and Department of Community Health, and that will affect how older Americans and older Michiganian Act funds who will oversee those grant funds. Right now it's through the Office of Services to the Aging, and there was an announcement Friday that the Office of Services to the Aging, or OSA, will be redesigned, and it will become part of the Michigan Aging and Adult Services Agency. So more information to come. I don't foresee it affecting the amount of grant funding that we receive, just because it's being reorganized as a state-level department. And also, to let you know, as I've mentioned in past years, Community Action Agency coordinates the Volunteer Income Tax Assistance Program, or VITA, and they have volunteers that come to Crouch Senior Center 2 days a week to see appointments for older adults regarding completing their income tax forms. And this is the first year that we're asking everyone to call Community Action Agency to make their appointment. And that number is 784-4800. Rather than calling our department, we're asking everyone to contact Community Action Agency. And they don't have to come to Crouch Senior Center. There are other locations in the community that they can have their tax forms completed. And there's the Friends of Jackson Seniors. It's a nonprofit organization, and this year the organizer of the Winter Blues Bash, if you're a blues music fan, the Alligators will be in town on February 21st, and the proceeds from the concert will benefit Friends of Jackson Seniors, and they support services that are provided by the Department on Aging. And I just so happen to have tickets if anybody is interested. So, any questions?
Administrator Overton?
Marcy, how long has the Friends of the Department of Aging been around?
I think it's been, I'd have to look it up, but I think it was 1994.
And do you recall what prompted the creation thereof?
The director at that time saw the need for a 501c3 IRS-designated nonprofit to be established because some organizations, especially foundations, will give funds to a nonprofit but not a county entity or a government entity. So that's how it got started, and they do have a fund at the Jackson County Foundation, Community Foundation, so that's when the first endowment started. So they've been pretty low-key, most primarily, but now they're getting more active, and we're having the Soups On for Seniors fundraiser that Friends of Jackson Seniors is doing, and again, that will benefit Meals on Wheels in that case. So, but that's why it started.
And correct me if I'm wrong, but aren't they also pivotal in millage
Yes.
approval?
Thank you for that reminder. Yes, they then are the group, the nonprofit group that gets the word out to please vote. We don't, as a nonprofit, they can't say which way to vote, but yes, they paid for yard signs that said, senior millage renewal, August 2014, so they do support the senior millage.
Marcy, for some reason I was thinking that a nonprofit could say vote yes for a proposal.
No.
They cannot.
Cannot.
I know we can't, but they can't
They
either,
can't
huh?
either, not as an IRS-designated nonprofit.
My thinking stands corrected then, thank you.
Thank you for that information. Any other comments, questions for Marcy?
Okay, thank you.
Thank you. Next on the agenda, we have the Health Department monthly report. Welcome back, Richard.
Thank you very much. Good afternoon, Commissioners.
Good afternoon.
Health Department extends a warm welcome. Congratulations to Commissioner Mahoney and Commissioner Waltz. Welcome. We're glad to have you on the board. My report is in your packet. I do have a few updates for you. One of the things that we've been working hard on really has to do with lead testing and hemoglobin testing and billing, if you will, of children who come through the WIC program. And we now have initiated an effort to reach out to Blue Care Network and Blue Cross Blue Shield as well, to engage with them potentially in a contractual agreement that would allow us to bill them for these services, number one, but even more importantly than that, we want to try to provide the same level of service to children who are covered through those plans as children who come through the WIC program who are enrolled in Medicaid. Medicaid already has a nurse education visit component associated with a child who might be lead poisoned, and we're excited to be able to approach Blue Cross Network and Blue Cross Blue Shield to see if they would also reimburse us for that kind of a visit. It's really important for the nurses to get into the home environment, and being a lead poisoned child doesn't have anything to do with income. If you happen to live in older housing, potentially your children are exposed, and so we're excited to be able to move forward with them in that relationship. We've done a lot of work and continue to do a lot of work with health integration, as you can see from the report. And I actually think that a lot of the work that we're doing in Jackson County with health integration ties in quite well to the state's overall direction in wanting to merge human services and community health. And we've been tracking that very closely as well through the public health side. We don't have a lot of information right now. Nobody seems to. I think the details will be coming out soon with the order that's been signed by the governor or is about to be signed, and so we'll be tracking that as well. I know last month I did have information in the packet concerning local health department regionalization. I'll touch on that for just a second. There's nothing in your packet today on it, but I just wanted to kind of follow up and give you an update on that. What we're hearing on the public health side is that as far as local health department regionalization is concerned, it's less about consolidation and more about regional service delivery and sharing of services. So we've already had some conversation between health departments in Southwest Michigan. In fact, I met last week with a lot of the health officers from the southwest part of the state, and so we're already engaged in those conversations and discussions. So that's the way we hope it goes. Influenza continues to be a significant issue in the state and as well as in Jackson County. In January, we did have another small, but still we had an assisted living facility flu outbreak, and my report indicates that all of the residents within the facility did receive their vaccine, but 50% of staff had received theirs. So I think there's room for us to improve vaccination rates again on influenza. on an employee and a staff side of things. We also have reached out to 3 providers in the community to ask them to become Sentinel providers. Sentinel providers work with the Michigan Department of Community Health to report and track influenza-like illness during the influenza season. And it gives us a much better data, if you will, on what's happening on the primary care side of things in the community when people go to see their primary care physician and they're diagnosed with an influenza-like illness that could include a rapid antigen test for flu as well. So we don't have any Sentinel providers in Jackson County, and we'd like to have at least one. So our medical director is currently working on that. We're excited about expedited partner therapy, which was passed and signed by the governor effective January 1st. What we hope will happen with this is that it actually will be effective to the point where it reduces our STD rate in the community. Chlamydia continues to be one of the highest incidence STDs that we see in Jackson County, and that's pretty much across the board, across the state, across all counties. And that was one of the reasons that EPT was put in place. It's been shown to be effective in other counties, and we're hoping it'll work here as well. On page 5, I have a little reference to the Jackson County Immunization Coalition development. This is really another one of our kind of health integration outreach efforts, if you will, to establish this on a countywide basis. We've gotten quite a bit of interest from this from our community partners, and we've now are trying to organize a meeting of core group people to structure it and to kind of define what it is that we want to accomplish. So we're excited about that. I think that was pretty much most of my updates, and I think that's probably it for the monthly report. I'll be happy to take any questions on that or anything else.
Thank you. What comments or questions might you have? Commissioner Placzek?
Hi, Richard.
Hi, John.
I'm happy to see that the county is putting together their immunization forum. I know that for the longest time you were involved with Allegiance Health and with our forum. And at our last meeting, I asked what happened just so that you know, why aren't we involved with the county like we were before? 2 things, some changes in how we can hand out or give away the immunization themselves
Right.
has changed, so we can't do that any
Yep.
longer. And our needs have become so great at the hospital, just covering our own flu and TB and everything else that we do.
Sure.
And
Yep.
I hope someone from the hospital will be taking part of that. I chair the one for the hospital, but I think Dr. Schultz might be a good person if she isn't already involved in that.
We will definitely be reaching out to Allegiance for someone to attend those meetings. Yep, you bet.
Anything else? All right, seeing none, thank you for that report. Moving on to the next item on the agenda, we have the Health Department 32P Early Childhood Programming Agreement with the JCISD. So we're being asked to approve here and move to the full board the authorization of the contract service agreement. Richard, is there anything specific you'd like to address with this topic?
Probably nothing real specific. We have had this relationship with Great Parents, Great Start for a number of years. This funding actually flows from the Great Start collaborative fundraising efforts at the state level, and it does support our early on program through the Toy Talkers and Parents as Teachers. And we've had this for 4 or 5 years now. And it's a little bit less than it was last year, but still it'll meet most of the need that we have at this point in time.
All right, so we're speaking of grant money here that's basically meeting our strategic priorities.
Correct.
What comments or questions might you have? If not, I'm looking for a motion to move it to the full board.
So moved.
Support.
We have a motion and support. All in favor say aye. Opposed, the same. We'll move to the full board for Tuesday night's meeting. Thank you, Richard.
Thank you.
Next in front of you on the agenda, we have other business. We have claims, the claims from 2015. Has everyone had the opportunity to look at them? Daniel, you're going to pay the claims. How thoughtful of you. Thank you. And support? Thank you. We have a motion and support. All in favor say aye. Aye. Opposed, the same. The claims will be paid. Thank you, Daniel. We'll tell your wife, okay? Other minutes? We have the meeting minutes from the last DHS meeting included in your packet. We have the March reporting schedule. In March, we will expect to hear from Department on Aging, Health Department, Lifeways, DHS, Medical Care Facility, and MSUE. Next on the agenda, we have public comment. We would encourage any public to step up and share their thoughts with us. Seeing none, we have committee member comments. Committee members or commissioners? Seeing none, we'll adjourn to the call of the chair.